it's the chicken or the egg in regards to, do you think that the system should be more responsible for quality of care? Or do you think the individual, so to speak, so like you and me and everybody else, should be educated more on how to take care of themselves better? Like better, should it be coming at an education level? Should we really, I mean, obviously the answer is both, but at the same time, do you think we'd see greater changes if we focused on trying to educate the public on like how to take care of themselves? Or do you think it would be more time efficient, just like try to get the policy in there and try to make healthcare systems work together to try and create a more efficient model for people?
I really think that this is the don't call me a socialist because I am not a socialist, but I think that it is kind of everybody's responsibility.
Hmm.
It's the responsibility of the health system. It's the responsibility of the individual healthcare providers, the insurance company, because we're not talking about car insurance here. Like these are people's like human lives,
Hmm.
and I think that they need to do their job and being altruistic in that way. But also, I think money talks. And I might have explained this to you or someone else yesterday, but I just had a conversation with somebody about my husband used to work for a company that they would actually give him cash payouts for completing a certain number of health related goals or tasks for the year. And one of them, or just to name a few, getting an annual wellness exam. So going to your primary care doctor and having an annual wellness exam, getting blood work done, checking into the gym at the facility a certain number of times per year or per month, getting an ergonomic assessment of your workspace. And there was, the list went on. There was like probably hundreds of items that people could sort of complete. And then they would get cash payouts to their HSA accounts. So that's just more pre-tax money for the patient. And my husband, he's a very healthy guy. Like he works out a lot, but he really doesn't care about like his personal health beyond like not gaining too much weight. But he did all of these items because he was like, yeah, I get a lot more money for doing that. And
Right.
guess what? The employer ultimately saves money by doing that.
Hmm.
So I think that incentive structures via employers, that's one really great way to speak to people. But then there's also, I mean, that was a major Fortune 500 company. Not a lot of employers can afford to do stuff like that.
Hmm.
Um, so I don't know. I kind of want to research like what the Nordic countries are doing and how it is there, because we know that in the Nordic countries, typically there is lower rates of obesity. People are healthier, lower rates of cancer and heart disease. And I kind of want to study that a little bit more, but I don't know. America's like its own little
Pocket.
right, and we just are who we are, and we do what we do, and we love our freedoms, and
Mhm.
yeah. So again, it's just a really hard question to answer, but that's where I would
Yeah.
start, like incentive structures.
Right. And I think, like we said before, I think it's both. We need to focus on the side of things where we need to be educating the public as much as possible. And we said this before, where we need to be paid for that, because even just being educated on pain can help affect your pain and how much pain you're in. And so I think I, I like that you got into the idea of also talking into, some of these work related things and how money talks, because sometimes the only way people can get involved with their health is like, hey, this is free, or like, hey, you're going to get money to do this. And they're like, oh, well, let's do it then, and that's the only way people are going to get involved, unfortunately. And maybe that'll change. And perhaps with education that could change.